This is USVI News, your Virgin Islands connection.
Hi, everyone. Thanks so much for joining us for USVI News. I'm Emily Matson. We want to send a big congratulations to Michelle Smith, the young Virgin Islander, for winning a gold medal at the Carifta Games.
Michelle Smith of the US Virgin Islands goes out quickly in lane number 5.
Watch as Smith dominated the 400-meter hurdles with a new Carifta record of 58.61 seconds. It's not only a new Carifta Games record, but a VI national junior record, too, and the world's fastest time for 2022 for under the 18 age group. What's more, Michelle Smith is the first Virgin Islander to set a Carifta Games record. And at the age of 15, her time qualifies her for the World Athletics U20 Championship in Colombia this coming August. The 49th Carifta Games is taking place in Jamaica. Smith is the fourth athlete to win gold medal for the VI. And by the way, next year, the Carifta Games are heading to the Bahamas, and we'll have a bit more on that coming up later in this newscast. Again, a big congratulations to Michelle Smith for winning gold and setting records at the Carifta Games happening in Jamaica. COVID-19 cases remain steady here in the territory. The spike we're seeing is likely from the BA2 Omicron subvariant, which is now accounting for most of the new COVID cases nationwide, according to the CDC. The VI Department of Health says several cases of the BA2 variant have been identified in the territory. And according to their latest numbers, there are currently 135 cases territory-wide, with 70 on St. Croix, 61 on St. Thomas, and 4 right now on St. John. The Transportation Security Administration, TSA, is no longer enforcing the federal government's mask mandate for travel. This after a federal judge in Florida struck down the CDC's directive Monday, ruling the federal government had no authority to enforce a national mask mandate on planes, trains, and buses. The CDC recently extended the travel mask mandate until May 3rd to allow more time to study the BA2 Omicron subvariant. But the White House says it's no longer being enforced as the CDC's public transportation masking order is not in effect at this time because of Monday's ruling.
This is obviously a disappointing decision. The CDC continues recommending wearing a mask in public transit. As you know, this just came out this afternoon. So right now, the Department of Homeland Security, who would be implementing, and the CDC are reviewing the decision.
Again, that travel mask mandate not being enforced right now for travelers. Meantime, the CDC is shaking up its COVID travel advisory system, removing every country from its do not travel list. So after months of warning all travelers to avoid a long list of countries due to very high COVID-19 levels, on Monday, the CDC removed all 89 countries from that list. The highest level 4 designation will now be reserved for special circumstances like a dangerous spike in COVID cases or perhaps a new variant. The level 4 list had at one time included well over 100 destinations, including the U.S. Virgin Islands and many other Caribbean countries. But again, there are now no current level 4 countries. Countries with a high level of COVID-19 are considered level 3. Travelers who are not fully vaccinated are still advised to avoid travel to those level 3 destinations, but the warning does not apply to fully vaccinated visitors. Travelers with a weakened immune system are urged to check with doctors before visiting another country or any place other than the U.S. Earth Day is this coming Friday, an opportunity, of course, for a long, hard look at the dangers of climate change and the ways rising temperatures could be threatening our health. Michael George reports.
When wildfires fill the California sky with smoke, Brandon De La Paz feels the pain.
I do remember going out and just kind of breathing in the air, and it just hurt a little bit more than usual.
De La Paz has asthma and could be facing many more days of discomfort. A Princeton study finds in parts of Northern California, the warming climate could cause particle pollution from wildfires to increase more than 50% by the middle of the century. Those tiny particles have been linked to cardiovascular disease and bronchitis. And for asthma patients, the effects can be life-threatening.
It feels like you're breathing out of a straw. And so as you can imagine, that can be quite uncomfortable, quite scary. People don't realize that we see deaths every day from asthma.
Thousands of miles from wildfire country, climate change is messing with Mother Nature in other ways that affect our health. As temperatures rise, so do pollen counts. That's because a warmer Earth means longer growing seasons, giving plants more time to shed the pollen that causes allergies. At the current rate of global warming, by the end of the century, spring pollen season is projected to start about 40 days earlier and last up to 19 days longer than it does now. Dr. Purvi Parikh recommends allergy shots for desensitizing her patients.
And what that does is that it eventually makes them stop reacting. So many of those individuals actually have had a very easy pollen season compared to those who aren't on it because their immune systems are not as reactive anymore.
The CDC says as many as 60 million Americans suffer from seasonal allergies each year, a headache that will likely get worse.
Scientists also warn that climate change will trigger more heavy rainfall and flooding, which, along with hot weather, may increase waterborne diseases as well. April is National Donate Life Month, a time taken to celebrate and bring awareness to those who have saved lives by becoming organ donors. Our USVI News' Haley Potter sat down with someone who recently donated a part of her liver and wants to bring awareness to others.
Back in 2012, Sammy Nepsa's uncle was diagnosed with pulmonary fibrosis and eventually put on a lung transplant list, but developed cancer and passed away before he could get a lung. More than 100,000 people across the country are currently waiting for a life-saving organ transplant, and in 2020, Sammy donated a part of her own liver to a stranger.
Just seeing the toll that took on my family and me personally, being able to donate something, while still being alive, and, going through 3 months or so of a little bit of discomfort and pain just to, save a family from feeling the same way mine did. That was kind of my inspiration for deciding to do this.
She saw a post online that said you could donate a kidney or a liver while you're still alive, a concept she wasn't really familiar with. Even though it was spontaneous, she signed up right away. 2020 was a dark year, and she tells me she wanted to bring somebody some hope.
Having that thought of, my uncle and seeing what we had gone through, it was just a no-brainer. I just wanted to go through with the process.
Sammy knew she wanted to help in this way, so after she did her research and her own set of testing, it was only a matter of about 5 months before she was donating a part of her liver.
I was kind of pedal to the floor, and I was a good, donor just because of my health and because of my blood type.
She says it's not always that quick of a process for everyone. She had to go through plenty of tests, both physical and psychological.
Everyone at UPMC would ask me, is this someone you know? Who are you doing this for? And I would always just say, I don't know yet. Whoever needs it.
Her surgery in December of 2020 went smoothly, and she was back to life as normal after 3 months of healing, and her liver grew back entirely. Even though her parents were worried about the process, her family was supportive throughout this entire journey. Throughout the process, she had no idea who she was giving a portion of her liver to, nor did she care. She just wanted to help anyone who needed it. Several months post-surgery, she got an email that she'll always remember.
And I had received an email from her, and she was so grateful. She said I was part of the family. If I ever needed anything, just to reach out. So it was a good feeling.
It all came full circle to her, to see somebody she helped living a healthy life once again. And this month sheds a light on the power of donating and being a live donor. And Sammy's message to others is very clear.
There are risks, but at the end of the day, if you can, deal with a little bit of discomfort for a couple of months and then, resume your normal life and save somebody in the process, it's so worth it.
And that was our Haley Potter reporting. And Sammy told Haley she would do it all over again if she could. If you want to learn more about the process of being a living donor, you could head over to donatelife.net.